and even the government. And then we're supposed to actually do something about those needs. And so we're supposed to facilitate health enhancing activities. And we do that in very many ways, on the micro level, the medium level, whatever medium is between micro, and on the macro level. Unfortunately, we can't do as much as we'd like to do, and we can't do as much as we're trained to do. But that's a story throughout the health service, and that's just how it goes. So I'll tell you a little bit about me. I am from Manchester, a long time ago. I don't live in Rochdale. I work in Rochdale. I do not live in Rochdale. And that's I like not living in the area that I work in, because it means when I'm not in work, I'm not meeting the families that are on my caseload. And as health visitors, we carry a caseload, so we are responsible for the health of a number of people. I'll be more specific about that in a little while. I am married with 3 grown-up children, and I've put that picture on because that was the most recent photo I had of myself, which was taken about 3 weeks ago in Uganda. And because of the work that I did, or that I do, it prompted me to set up a health charity over in Uganda. So that was me in Uganda 3 weeks ago, having the time of my life. So education-wise, I trained as a nurse at Tameside, which is Ashton, and in those days training was hospital-based, very much hands-on. I would say that the academic level of it was not the best, but they did, we turned out to be nurses who could work on the ward and be effective on the ward if we were motivated and willing to work hard. But it was not degree level. We only had, like, at that time it was GCSE level or O level requirements, and I'd left school and left home at 16, and I had enough O levels, and I trained as a nurse. I later moved to Burnley and trained as a midwife, and then after a few years I applied to do my health visitor training, and that was because I wanted to work in the community. And so I attended Manchester Met and did my health visiting and public health diploma. So I would say that health visitors are a jack of all. I won't say master of none, but that's what the phrase that usually carries on there. When I worked as a midwife, I felt I was not the best, not the worst midwife, but I had an area of speciality, an area of deep knowledge. Nowadays, I feel I have a very wide area of knowledge, but I'm not practicing any practical nursing skills or any practical midwifery skills. So sort of jack of all and master of none does tend to slip off the tongue, and I'm not sure that that's the best description, but it's the one I'm sticking with for now. Does anybody have any questions? Everybody's very quiet. I feel like I'm speaking into outer space here, so please interrupt me if anything crops up. Okay. I followed the template for this PowerPoint. So I work in the centre of Rochdale, and I'm employed by Northern Care Alliance, which is a large organisation providing health services to a lot of the north of Manchester area. My clinic base is in the centre of Rochdale, cover a real ethnically diverse area. We provide a service to all families. So if a lady, a girl, a woman is having a baby, we should make contact with them antenatally, but we don't always have the time to do that with everybody. But as soon as that baby is born, we will visit between 10 and 14 days. With the idea, if you think back to those principles of searching for health needs and helping the families to identify their health needs. So on a good day, you know, I'll go and meet my families, and they'll have had a new baby. They'll be tired, but they'll probably feel happiest they've ever felt in their life. Generally, that's a generalisation. And we'll have a nice talk about how they're feeling, how the baby's doing, any worries, how they're recovering from the delivery, what makes life hard at the moment, what challenges there are, who helps, what worries they've got. So we cover a lot, you know, a lot of things going on for that family at that time. And you know, we're there to support them. If they've got challenges, difficulties that we can't support them with, we're like a gateway service and we can refer to other services. But everybody that has a baby in the UK will have a health visitor. So we're what's known as a universal service. And on a good day, it really is the best job in the world. On a bad day, it can be very scary because you can be very worried about the babies, the children, the mums, the dads, the families, the communities that we have a professional obligation towards. So we will meet our clients, or some people call them patients, but we like to call them clients, and we'll meet them in the homes, the clinics that we run, children's centres, GP surgeries, schools, nurseries, and the premises of other services that might be involved. And we do work together with other services to help the families as much as we can. We're based in the centre of Rochdale, and in Greater Manchester, the area that we cover is recognised as basically the most deprived in the Greater Manchester area. There's some other areas that have greater challenges in some parts of the measures that they use for working that out, but overall where we cover is really quite a challenging area, quite deprived area, and we have some amazing people that, despite those challenges and despite the areas, we have the gift of meeting amazing, lovely people. We do also have the challenge of meeting some people that can, you know, test us and make life a little bit more difficult, make the job a little bit more difficult. Overall, it's a really, really privileged job. But what I would say is that as a health worker, you know, working with babies, children, mums, families, we feel very responsible. We say the first 1,000 days are critical in a baby and child's development. And in that first 1,000 days, we include the 9 months of pregnancy. And then looking at the first 2 years of influences and experiences in that child's life. And it's you know, it can be quite intense. Sometimes when you read what I've written in red at the bottom of that slide, you can feel like you're failing, because actually, if you look, the life expectancy for people in our area is actually 5 years lower than the average for England. And that's a little bit soul destroying when you stop and look at it like that. But if you looked at all the negatives, you would never get out of bed in the morning. And actually, there's a lot that the health service and teams and professionals can do to change that for people and help people have better health experiences. So that's just a little bit about where we work. So I think I've said this. So, you know, everybody who has a baby or a child under school age has access to a health visitor. We support the health and well-being of pregnant women, new babes and children. And in a respectful way, that's open and honest, because we don't want to promise people we can solve all your problems, because we can't. But we, we really do try and help people to be as healthy and as happy as they can be in their parenting, in their family life, and we'll do the best that we can to help that. A big part of our work is to monitor the development of babies and children, and we have specific times that we'll do formal developmental assessments. So a big part of our role is to understand child development, and if there are any concerns, then we can either intervene ourselves and offer advice, support, put a little plan into place and then review the progress, or we can refer on to specialists and work with specialists to help the families stimulate and get that child the support that it needs so that they can meet their potential. As health professionals, we have a code of conduct, and part of that we're responsible for what we do and what we don't do. And that's just leading me on to say that we do have a role in child protection. So we have a legal, professional and moral obligation to act on any concerns of a child's well-being and safety. And we work openly and honestly with families in partnership with other agencies around that. And that can be a big time-consuming and head and heart consuming part of the role as well, but a very, very important part of the role. Anybody got any questions? I'm talking a lot here, and I'm not getting anything. I don't even know if anybody's there still, but no questions? Okay, I'll carry on. So yeah. So just some of the challenges that we have, and this is throughout the health service and the services that we liaise with and work together with. Like all government services, we're short-staffed. We struggle for staffing, and we struggle to retain staff. It's a challenging area that we work in, and that means we can't always pick up things as quickly as we'd like to. We can't always respond as quickly as we'd like to, and you have to prioritise things, and that means, sadly, some children do not get it, as long as it's not, if it's something very serious, very important, it's responded to. But if it's, if it's a minor concern, sometimes families have to wait for us to be able to fit them in and visit them 2 or 3 weeks later, which isn't always satisfactory. Families come with their own difficulties. They might have physical health needs, emotional health needs, or developmental learning needs themselves. Sometimes there's, within families, there's the challenges of addiction, violence, domestic violence, housing issues. We're really struggling with housing issues here in Rochdale at the moment. There's such a shortage of suitable housing for rent for families. Some families don't have the literacy skills that we need to be able to access services, and that can make life very difficult for them. So that's an added challenge. And all these, as I've said there, they can impact upon the well-being of a baby and a child, and basically restrict their ability to meet their full health and developmental potential, which is unacceptable, not what any of us want for ourselves or anybody else. And also it can put them at risk of neglect and abuse. And again, so that's something that is, an important part of our work again. I've said a little bit about the job. I haven't broken it down really into a day-to-day, but I'll just describe yesterday for you. So yesterday I was in work just before 9 o'clock. We have a team meeting every week where we discuss issues. Those issues can be caseloads, difficulties that we're having, sorry, excuse me, with systems, IT systems, things that are changing, new information that's coming in from other services. So, you know, we have that weekly meeting. It's usually, some of us are in the office, some of us are working from home because we have to socially distance in the office, so we have to take it in turns who can come in and who can't. Following that meeting, I went to visit a mum who has her first baby, but who had developed serious kidney problems before she had the baby, had to have surgery, and had had 3 episodes of sepsis since then, and baby was only born in October. So mum spent a lot of time in hospital, and she's feeling very weak, feeling like she's having to depend on people a lot for help, but also feeling that she's letting her baby down because she's not the one taking him out. She's not the one that has always been there for him. She had to give up breastfeeding because of the antibiotics that she needed. So although I wasn't addressing her physical health needs, we had a long talk about bonding and attachment, baby's development, how important some of the things that she was doing were, and also helping her to see just how much her baby enjoyed looking at her, listening to her, how he was comforted by her presence and her cuddles and her responding to him. So and also referring her onto other services that are much more skilled at helping to address anxieties and low mood in the postnatal period. So we're identifying, we're holding her steady, if you like, and supporting her and listening to her, but also referring her on to the experts. After that visit, I then went to see another mum and her little boy. This mum is from a different area. She moved in here last year, and her children are on a child protection plan. And we were having a meeting today, so I just wanted to go and catch up with her, remind her about appointments because she's been missing appointments for his health needs, and to find out what was the difficulty there in doing that. And just sort of supporting her and reminding her about the meeting today. That mum does not have English as a first language, so we had to have an interpreter. The child has got some developmental delay, and so trying to understand fully what the little boy's development, how it's progressing when you're having to use your own observations, but the child doesn't respond to you, and you don't know if that's because he doesn't understand English or if he's being shy because there's 2 people there, and mum, and the information coming back is via the interpreter. So you're juggling a lot of things there. After that, then I went to do another visit to a mum with a brand new baby. I'd not met this mum before. Baby was born by an emergency cesarean section, and we had a lot of talk about her physical recovery, and also just some feeding difficulties that she was having because the baby was born with a tongue tie, and trying to support her to continue with the breastfeeding, and how that can be supported when baby's really struggling to latch on, while she waits for the appointment to come through for baby to have the tongue tie cut, basically. So 3 very different visits, and then when I came back, I just only had time then to write up the rest of the work that day, because there's a lot of record keeping involved as well. So 3 very different visits, quite broad in their scope, but the central theme obviously being mums and children and babies. I didn't meet any of the, yesterday I did not meet any of the dads. In the first family, dad was out at work. The second family, mum and dad are separated because of domestic violence. The third family, dad had done, had taken the older child to nursery and was going picking them up, so I didn't meet the dads there. But it's not just mums and babies. We like to involve dads because we know that dads, you know, children and dads also have a very good bond, and if mums are supported by the dads, then you know they're not as worn out, not as distracted, and the chances of them having a really good bond with their baby is also helped. There's lots of research, and if any of you are studying psychology, you probably will have seen scans of babies' brains where there's neglect and emotional abuse of children and babies, and how their brains develop very differently, and it can be seen on scans. So it's a big part of our work is to, you know, really encourage and support the bonding and attachment of babies within the family. So that was my day yesterday. I've whittled on now for a good 20-25 minutes. The template that was sent to me, and I haven't modified this at all because I think it works. It says it all really. If you know what you want to do, work backwards, you know, and start planning for it. You know, maybe earlier on in your in your school life, you know, towards, are you doing the right GCSEs? Do you then go on to do, you know, A levels or BTEC and moving on? What I would say though is, from personal experience, both, you know, a long time ago, I was your age, and also I've had children that were your age, and not everybody knows what they want to do at this age and stage. I wouldn't worry about that too much, but if you do, that template there, it says it all. If you don't, speak to people that you know well, you know, your college staff, your family, your friends, and don't panic about it. It would be my advice. Okay, you've heard enough from me. That's the next one. Any questions, please talk to me. If there's no questions, thanks very much for listening. I would say health visiting, nursing, midwifery, wonderful, wonderful careers that can fill your soul. And you know, I feel very privileged to have been able to have done this job and had this career. There are times when, yeah, it's been challenging, and sometimes you go home and you can cry, you can lie awake worrying, but that's because you care. If you don't care, you shouldn't be doing the job. So I'll be quiet there, and just speak up if anybody has any questions, and I wish you all the very best. Thank you.
Hi Carol, I've got a question.
Yeah, who's this?
It's Fiona, sorry.
Thanks, Fiona.
I just wanted to ask, you said that you don't work in the area that you live, so you work in Rochdale but you live somewhere else. Yeah. What happens if you do bump into your service users, your client patients?
Well, I mean, it's mostly not a problem, because I don't have young children now in the area. I don't use the local services, but I know if I was a younger person, had children, and I bumped into them in the library and their children saw my children, they could quite rightly wonder, have I told my children anything about them, and does my child know? Well, you know, it's not fair to put them in that position of anxiety. It's also not fair of them to approach me with any questions when you know, if I'm on my days off and I've got my children with me, then that is my family time. Obviously, I wouldn't, if somebody asked me a question, if I could, you know, approach me, of course I would answer. But I do think it's very healthy that when you're not in work, you are off duty. There's also a question of professional liability. You know, if I spoke to somebody out of work, I can't record it. And they could, you know, if I've not recorded it, I have no protection if I'm then challenged about anything. So personally, I would never want to do this job in the area that I work. I know I have colleagues that do and they manage it. Personally, it's not something that I would like to do. And I think it's something that as a team, we do sometimes, if somebody, a new birth comes in, if somebody had a new baby, a colleague will say, oh, that lady's got a child in my child's class, will somebody else take her? Because she's more likely to bump into her in the playground or a parents' evening or a social. And I think it's very important to keep the private and the professional separate. And actually there are guidelines from the Nursing and Midwives Code of Conduct about that as well.
Okay, I've got one more, sorry.
It's all right.
So you deal, like you were saying, you deal with a lot of sometimes serious issues regarding safeguarding and things like that.
Yeah.
How do you manage not to take your work home? Is it a skill? Is it something that you learn, or?
I think I would be lying to say you don't take your work home. When you come back to the office, we can talk with our colleagues. We call it like an informal supervision, and we're always doing that. You know, this family's this. What would you think? If it's a safeguarding issue, there are procedures to follow, so you follow those. So you've got the security of that. But what I would say is you do still go home and worry and think, have I done everything I should do? Quite often, my concerns are not always if I did a referral into children's social care, they may say it does not meet the threshold, and we might have to discuss that. And sometimes, you know, that can be quite difficult. So you're challenging your colleagues, but it's about also experience. So I don't worry about things as much, or I can compartmentalize it and say, right, it's Friday night now, Monday morning I'll revisit this, because there's nothing I can do over the weekend. If it was something really serious, you'd be ringing the police and you'd be ringing the duty social workers, and you'd set the balls in motion. I suppose also being lucky enough to have family and friends, and also having, you know, a busy life outside work. So like all of us, we all have things that worry us, and that's what young life is about, learning how do we cope with the things that worry us, who helps us, who doesn't. But the code of conduct says if you're worried, you raise your concerns, and if you've raised them, you've done your work then. You've set the wheels in motion, and if it is anything highly critical, you know, there are other organisations, there's the police, there's the social workers, that you hand that responsibility over to.
Thank you very much. Has anybody else got any questions that they'd like to ask Carol? Come on guys, don't be shy. You can put it in the chat box.
I'm just asking her what you did in Uganda.
Oh, in Uganda. Right, okay. So I was lucky enough, I had to pay to do it, but I was lucky enough to go out to Uganda with another charity, because I'd always wanted to go abroad and see if I could be of any use. And I realised when people were bringing children to us to say, my child's not well, and I would be saying, you know, really quite naively, take them to hospital, take them to the clinic, you know, you've got to see somebody. And actually they can't get there. That, you know, people in the villages, the first obstacle to getting to healthcare is transport. So we actually have we provide transport. We have a social worker that drives the vehicle. We have a nurse, and we provide transport for healthcare needs for people, children and people from villages. But also we take healthcare workers out into the community to follow up people who are not coming for their HIV medication, or people that they've seen in the clinic or previously they've been worried about. So we're actually providing transport for healthcare needs. And I think that did, you know, that has flown from, or that grew from, you know, the fact that, you know, here we can get children to hospital, we can get people to hospital. I'm not saying you won't have a long wait when you get there, but, you know, we don't have the same obstacles, and I wanted to just see if we could do our little bit to remove those obstacles for some of the people there. Yeah, does that make sense? Hello?
Yes, thank you.
Yeah. Oh yeah, sorry, yeah. And I love it out there. Yeah, it's fabulous. Yeah. I don't do any nursing out there myself because my qualifications are not registered in Uganda. We would not expect somebody to come from another country and start practicing healthcare here without having their qualifications ratified here. And, you know, the same applies over there. Yeah.
Has anybody else got any questions? I can't believe they're all so quiet.
Yes, I've taught them all to sleep. I told you I would do, Fiona.
That's really interesting, actually. I've really enjoyed it. Yeah, and I'm so glad that Emily asked you about Uganda, because I wanted to ask you when you brought up the slide.
All right, yeah. Well, yeah. It's a tiny charity. Oh, that was a steep learning curve. I didn't know how to set up a charity, but having realised there was a need, I couldn't walk away and ignore it. I had to try and do something. If I failed, at least I'd have tried.
Yeah, well, that's amazing. That is. It's a completely different lifestyle over there than when you.
Oh yes, yeah. And I think that's the other reason why I'm passionate about the health service. When you see what it's like when you don't have a health service like ours, consequences are dreadful, and that's why we have to fight for our health service.
And appreciate it.
Yeah, absolutely. Yeah.
Right. Well, if nobody's got any questions, I'll let you go then, Carol.
Yeah, and like I say, if you want to share my email contact, and then if anybody has any questions, you know, send them through if something occurs to you. I know it's a funny job. It's a very broad job. Like I say, very broad spectrum, but it's an amazing, wonderful job. Yeah.
You've got so much experience as well, because you started off, like you said, as a nurse and then into midwifery. So you've done like the full breadth of it, really.
Yeah. And you know, I've had other experiences in between. I've done family planning work. I worked as a specialist health visitor for people with HIV. I've done counselling, counselling courses, but I'm not employed or practice as a counsellor. So, yeah, it's really been a career that's given me a lot. You know, it's taken a lot, but you know, it's given me a lot as well. Yeah.
Well, that's amazing. Thank you so much. And speak to our students. I'm sure they all appreciate it. And thank you very much. Right, guys. Thank you very much.
Okay.
If you've got any messages, let me know and I will pass them on to Carol for you. Okay. Thank you.
Thanks. All the best, everyone. Bye.
Thank you.
You're welcome, love. Bye.